really want to make sure that the environment becomes part of the healing process so that it allows for staff efficiency, a feeling of safety, feeling for anybody that's in that environment to have some sense of not being overwhelmed by the environment. Having a place that's way too open is sometimes really overwhelming, so kind of providing layers and landmarks that people can kind of see forward to and feel themselves in this place as part of this place. You want to make sure that there's some kind of natural materials, I think, that help people feel home. There's so much cleanliness and infection prevention that's involved in healthcare that you really need to make sure that it's not just only about that and people feeling like they're in a clinical, I'm a research rat kind of thing while they figure out how to take care of me. There needs to be warmth around the environment so that you can feel comfortable and that you can let down your guard and be yourself and allow yourself to heal and allow yourself to have a rapport with the clinicians that are trying to help heal you. Sometimes you need to talk about that, recognize that this isn't necessarily about their experience and somebody wanting to be alone and by themselves all the time. You need to understand that different people regulate in different ways. So allowing them to have different spaces so that they can change that up and regulate themselves, whether it's a view to the outside or a space that they can walk and pace, or a quiet room that has less stimulus but not as many medical tubes and whatnot around, that if somebody can have a break from that space and have a quiet time, or a rocking chair can really make a difference with somebody so that they can regulate themselves really makes a big difference. And allowing the staff to also have some of that space so that they can take a moment, so when they reach compassion fatigue, which can easily happen, that they can bring their best selves to that patient interaction.